Everybody, if you have arthritis in your hip or in your knee, chances are you've talked to one of your providers over the years about injections. And the injection of choice typically these days is cortisone, okay, or prednisone, or a corticosteroid injection. This injection, if this is a joint, what they do is they insert the needle into the joint and bathe the inside of the joint with the steroid, okay? The thought process behind this is that, hey, if we reduce the inflammation within the joint with this powerful anti-inflammatory, the patient's gonna feel less pain. Duh, works a lot of the times as long as they get it into the right spot and as long as that joint is what's actually causing the pain. So the problem is, Journal of Radiology is actually finding four adverse reactions to this, and they're actually kind of questioning, like, are we doing more harm than good? In fact, they title this as perhaps not as safe as we thought. The four adverse reactions that they're finding is accelerated osteoarthritic progression, subchondral insufficiency fractures, which basically means there's fractures along the bones where they come together, complications of osteonecrosis, and rapid joint destruction. So they're actually finding this gets accelerated with the injection of the steroid within the particular joint. So that's why a lot of physicians are saying, we can only do a couple of these, that type of thing. But they're actually finding an increased incidence of getting these injections. So they're like, are we doing more harm than good? Are we doing what we're supposed to do? And you need to look at what is actually causing the joint to get arthritic. And arthritis or osteoarthritis or degenerative joint disease, degenerative disc disease, if it occurs within the spine, these are all degenerative processes, and we have to ask ourselves, what is leading to that cause of it being degenerative? Why is it starting to break down more and more and more? Next week, what I'll do in the video is I'll explain in detail how a joint degenerates and what you can do to halt that degeneration. So I hope you guys have a great rest of your weekend. Take care, and we'll see you next week.